Hi, it's Michael DiDomenico with some breaking news in the sleep field. Two major players are joining forces to improve CPAP compliance. React Health will be integrating EnsoData's AI CPAP adherence prediction software into their CPAP platform known as React Health Connect. Joining us today is Chris Fernandez, Executive Chairman and Chief Research Officer at EnsoData. Chris, welcome.
Thank you, Michael, and very excited to be here and thrilled for the opportunity to share a little bit more about our partnership with React Health that we're announcing.
CPAP adherence has been hovering at about 50% over the years. There's been improvement in technology as far as equipment and masks go. How will this help patients to be more adherent with their therapy?
Yeah. So this, the impact on patients is going to be, better support on CPAP therapy. The strategic partnership and collaboration with React is all about optimizing PAP adherence support for patients that are on sleep apnea. And so in the course of the partnership, EnsoData, we're going to be integrating our adherence prediction AI into React Health's recently launched React Health Connect platform, and really empowering referring physicians and DME suppliers with a lot of actionable data that they've really never had before, enabled by predictive AI, to be able to provide even more timely and personalized support for patients who are struggling with therapy adherence. And so maybe I could share a little bit about how it works, and that would help to explain the potential, the benefit and the impact on patients, as you asked, Michael. So in terms of the engine, the PAP therapy adherence AI leverages the telemetry data, the usage data that's collected on the PAP devices every night. Not only does it look at sort of the usage data, but it looks at other parameters on the CPAP machine, including mask leaks, pressure levels, and other factors. In total, more than 700 data input features go into these predictive models. In terms of patients that we've looked at, we've seen more than 250 million nights of PAP usage data across over 140,000 unique patients so far in developing these AI models. Based on our machine learning and AI publications at the Sleep Conference earlier this year, we demonstrated that these models have the ability to predict 90-day PAP adherence and compliance in a very accurate way with as little as just 7 days of data. So within the first week of therapy. And so to the original question, in terms of the impact on patients, the most direct benefit to patients is they're going to get the support that they need when they need it to be able to improve their ability to manage their sleep apnea. At the beginning, they'll get very hands-on setup and patient education. And in the very early phase of treatment, there will be another overlay of support and analytics that's helping those sleep coaches to guide those patients through that very early and critically important part of the journey in an effective way to help to boost and optimize both 90-day and long-term compliance.
Chris, how long has EnsoData been working on the technology?
That's a great question. We've been actively engaged in AI and machine learning research in the sleep space all around the challenges in patient diagnosis since about 2015. We were really passionate about trying to expand the scope of the problems and opportunities that we can help to address, with AI and machine learning. And so back in 2018, 2019, recognizing that adherence and compliance on not only PAP therapy, but sleep apnea therapies in general is a major challenge, began to focus on the problem of how we could use AI and machine learning to try to improve that. So back in 2020, we did our first research publication on predicting what we called PAP adherence phenotypes to try to understand if there were different groups of patients that might respond in similar ways to similar types of outreach, such that we could optimize its effectiveness. We also tried to predict the impact on adherence of different digital or technical interventions to give sleep coaches a lot of information on how the different tools at their disposal might be able to make an impact. We followed up on that work every year. Since then, in 2021, looked at that problem from an unsupervised learning standpoint, and at the Sleep Conference just this last year, published newer versions of the models with some of the largest data sets that we've looked at so far with collaborators at Kaiser Permanente, UCLA, the VA, and other institutions. So we're really excited about from a scientific and research standpoint, it's very early in the development of this therapy AI technology. We're very excited for a lot of new capabilities that we'll be able to introduce as we continue to work on this problem ahead.
So this is really remote patient monitoring built in a little more advanced than what typical platforms have been in CPAP machines. Is that a fair assessment?
Yes, we want to enable connectivity to get the right care to the right patient at the right time, and to do that in an even smarter way, enabled by AI, more than 250 million nights of data and a lot more to come to help to inform and guide the best course of action.
Chris, tell me about the benefits for the DME.
Yeah, the most direct benefit that we anticipate from our relationship with React Health is to reduce the number of patients and devices that DMEs aren't fully reimbursed for. As we've kind of talked about, there are a lot of patients that start PAP therapy every day, and managing PAP adherence for a large number of patients, especially at the scale of hundreds of thousands or even millions, is really challenging for DMEs. The traditional or historical adherence management tools that aim to help kind of manage patients by exception haven't proved to be scalable. I think especially for DMEs with large and continuing to be fast-growing patient populations. Unfortunately, though, this challenge leads, as many as 40% of patients not meeting the criteria that Medicare and insurance companies have to fully justify reimbursement for the machine, and that's not good. So the most direct benefit, from the relationship with React Health will be to reduce the number of patients and devices that applies to, and that they are ultimately not fully, reimbursed for, to help to address that challenge. There are two other indirect benefits as well. Patients who are adherent ultimately, need to get new masks and filters and supplies from time to time as those wear out. So, the more patients who are adherent, the longer the DME gets to continue their relationship with that patient, related to the supplies as well. And, as we've seen finally from different, publications on the impact of, CPAP adherence on different chronic diseases, just in one example, Journal of American Medicine Association found that patients with heart disease and sleep apnea, there was a relationship between adherence on CPAP and a 31% lower likelihood for a major cardiac or cerebrovascular event, including mortality, in that study. And so this is something I believe that healthcare insurance companies and payers are increasingly aware of. And, in being able to take advantage of these tools, and hopefully in being able to elevate the, level of adherence and compliance in the populations that they manage.
Chris, congratulations on this partnership with React Health. As we close it out, where do you see the technology going? What's on tap for EnsoData as we move into the future with AI?
Yes. Well, yeah, thank you again, Michael, for the time today. And we're super excited about the integration and the partnership with React Health and the React Health Connect platform as well. So excited for what's ahead there, and very excited for what's ahead, as you asked, on the therapy AI technology front. I think that, where we see things heading is both further upstream and downstream within the therapy care pathway. 7 days is pretty early in the patient journey for AI to be able to accurately detect, patients' likelihood of meeting that 90-day, first 90-day hurdle. However, a lot more benefit, we could amplify that benefit even further by taking it even up to day 0 in that care pathway, leveraging integrations with other data sources like the electronic health record to produce those kind of day 0 predictions and enable an even greater level of education and support to be applied at the very initial setup and education program for those patients that might might struggle. And so I think that that's an exciting opportunity. You know, on the kind of the downstream, you know, I think that it's pretty early on overall in the remote therapy monitoring and remote patient monitoring space as it relates to sleep apnea. So we'll see a lot in the way of AI technology that can really enable new capabilities that help to support these large and growing populations of patients, with the also growing trend, you know, of sleep coaches and sleep health educators that are rising rapidly, you know, kind of across the country. We're very excited about, you know, the trend in wearables overall, and how, you know, additional data like that can help to augment a comprehensive AI approach, and, you know, a lot more to come. So those are a couple of things that we'll be looking out for over the near term in terms of new tech and new AI capabilities in therapy.
It's exciting stuff, Chris. Thank you very much. Thanks for all the work you guys are doing at EnsoData to improve the sleep field and improve now CPAP compliance. Take care, Chris. Thanks.
Thanks, Michael.